Hi, my name is Kayla Treat. I am a pediatric genetic counselor here at IU Health. I have several colleagues, both genetic counselors as well as medical geneticists, so physicians trained in genetics. And we see patients and families suspected to have genetic conditions. It starts by when a family gets or a patient gets referred to see us. We will meet with the family and collect medical and family history information to identify what genetic testing, if any, is appropriate for the patient. And then carry forward with that testing, and then as a genetic counselor I would be responsible for talking to the family about the test results, and if a diagnosis is made, go through what can be expected, what we know about that condition, as well as not only educating the family to a level that they would understand genetics concepts, but also connecting family with support resources and making sure that I'm acting as an advocate for the family. And there is a lot of desk time that's involved as well, because we're helping coordinate the genetic testing. So there are some behind the scenes things involved, like helping inform families of the insurance authorization process. What's the test going to cost? As well as calling families. We always call families with results before we set up an appointment to go over them. So we spend a fair amount of time on the phone with families, kind of doing that initial education and getting initial reactions and thoughts. One of the big things that really drew me to the career is that it's a patient-facing role, so I get to work with patients and families. Of course, if you're delivering a pretty devastating diagnosis about a condition where a child might have a decreased life expectancy or might develop more medical problems as they get older, that's obviously going to be devastating to the family. Other times we might talk about a diagnosis that just gives the perfect explanation finally of what their child has struggled with for years, because sometimes we're not seeing these patients right after they're born. It might be years and years before we actually see them and get a diagnosis. So sometimes families are happy in a way to get answers and clarity. Getting to know that we are helping families through a difficult time, we get that feedback at times where families are so appreciative of us taking the time to kind of explain these really complex concepts to them in a way that they can understand.